You are listening to the INCJ podcast, Conversations about International Criminal Justice.
Greetings, I'm Ashmita. I am a research associate at Nicora Associates, and welcome to this discussion on the study on prevalence of domestic violence in India. Today's discussion is going to focus on how, as vulnerabilities of women heightened with COVID-19 induced lockdowns, we saw an increase in the reporting of domestic violence cases. What follows will apprise us of the nature of the increase of the prevalence of domestic violence, what form of government support was provided through different channels and measures and schemes, and what changes we can expect in the government's response or policy action going forward to improve the response in curbing domestic violence. Introducing the panelists who were a part of this study. We have Geetika Malhotra, who is the research manager at Nicora Associates and is a global shaper at the Global Shapers community. She also in the study led the research on government support for domestic violence survivors. Mitali Nikor is an economist and gender policy specialist. She is the founder of Nicora Associates, a youth-led research group, and advises multilateral organizations such as ADB, UN Women, and the World Bank, as well as other private sector consulting firms such as EY and PwC. She is also a part of the Global Shapers in New Delhi and conceptualized and led the research team and also liaised with global counterparts working on similar research. Manvika Gupta is a research advisor at Nicora Associates and is also a global shaper at the Global Shapers community. And in this study, she led a portion for the projections and estimations of the number of women impacted by domestic violence in 2020, and also the correlation between economic and women empowerment with domestic violence. So in this study, as a part of a broader research on domestic violence, Mitali, I would like to pose this question to you as the lead researcher on this. What is the purpose of the study? What is its relevance? And would you like to tell us something about this entire research in general?
Absolutely. Thank you so much, Ashmita, for that lovely introduction and very comprehensive. So I think I'd just like to give a little bit of a background as to how and why we embarked on this study. So all three of us, of course, met. Manvika and I knew each other from before. We had been working together at Nicora Associates. And then we met Geetika through the Global Shapers New Delhi hub, which we all three belong to. And we conceptualized a project to work on and address the issue of the shadow pandemic during COVID, because we started noticing that the data was already flowing in, and we could see that domestic violence complaints were rising. Now, of course, we know that as a global phenomenon, complaints are always a very small proportion of actual prevalence. But if we see an uptick in complaints, that means that prevalence may be rising much, much more. So based on that, we decided to embark on a two-folded project. The first part of which was to actually become part of a global team, which was led by Florence Semagal from the University of Oxford. And a number of researchers came together from different parts of the world, almost 35 countries, including India, to understand how the shadow pandemic was playing out in their regions. And then the second aspect of our intervention was to work with college students and undertake some bystander intervention trainings. So in today's discussion, we'll first talk about the research, and then we'll get into some of the ground level interventions that our team did. But as we get into the research, I just want to lay the foundation. And if you can move to the next slide, I really want to show this data. If we look at these two graphs, very clearly, and these are complaints. One of the set of complaints mechanisms that is available in India to report on domestic violence is to report to the National Commission on Women. And we can clearly see the two curves for 2019 and 2020, where the 2019 curve is literally at the bottom and the 2020 curve is like a shift And though the number of complaints is minuscule, for a country where the size of the population is more than a billion, a monthly complaint number of 133 or 148, I mean, these are just laughable. But obviously, this just shows the kind of barriers to complaining that continue to exist and the social norms that continue to shroud, complaining against domestic violence in a formal setup. But even so, and having said that, we can clearly see the immense exponential increase even in this set of complaints to the National Commission of Women between 2019 and 2020, especially in the months of the lockdown. When we look at the curve for May, June, July 2020, especially July 2020, at which point it starts to come down. So the motivation for this study really stems from the fact that the shadow pandemic became as prevalent as the COVID-19 pandemic, but didn't receive the kind of attention and the kind of redressal that was required. And for it to be recognized, that to be locked in a house during the lockdowns, during the COVID-19 pandemic, with the perpetrator of violence in your life 24/7 was a lived experience for millions of women in India and millions of women across the world. And till today, I mean, the COVID pandemic has come and gone, but the shadow pandemic continues. And we have not been able to find, even till today, the resources and the political will to address this pandemic, despite the fact that it's been an emergency issue for decades. So, that was our motivation. And, the research that we did actually comprised of a number of pillars as well. The first pillar was really to estimate and project how much the prevalence is, because obviously looking at the complaints data does not give us much of a guide on actual prevalence of domestic violence in the whole country. The second was to try to understand the lived experience of a number of women and their experience of complaining, of actually going and trying to seek help from authorities during COVID. And, we did that as well. And then the third aspect that we looked at was gaps in budgets. And what we found, of course, there's a beautiful study by Oxfam that we referred to throughout our research, which actually projected that there was a nearly 70 to 80% gap between allocations and requirements just when it came to meeting the targets that governments have promised should be met as per their scheme targets, not even as per prevalence. So we have that study, but then we came out with our own estimates, which were also very much in line that for 2020 prevalence, what kind of resources and budgets are required, and they are far higher than what is getting allocated. So while a lot of this research will come out in our book chapter, which should be out in maybe a year's time, and is under review by a number of publishers. But today we just want to give a flavor of some of these aspects. The most important aspect, 3 aspects we want to talk about today. First one being the actual prevalence estimations, and what we and Oxfam also has a similar methodology for estimating prevalence. So we have looked at that. But the second is around what are the measures that some states are taking and even the national government is taking to assuage domestic violence in that sense, and to at least try to provide some basic level of services. But the third aspect that we'll be discussing much more in depth towards the end is really what can be done. One, of course, by governments. But this is not just a government's issue. This is an issue of civil society. This is an issue of private sector. This is an issue which impacts women's labor productivity. This is an issue which prevents women from working. So it's not only the government which is to be held responsible, but all pillars of society. So what can we do across the different societal pillars to manage and reduce the prevalence and prevent domestic violence? So I think that's the agenda that we are laying out for today.
Ali, thank you for your answer, and it definitely lets us understand how necessary this research study is. And now that we know that, Manvika, I would like to ask this question to you. Even though we're aware of how frequently women encounter domestic violence in its various forms, can we estimate, and what is the estimate of how many women were impacted by the shadow pandemic in India?
Thanks, Ashmita, for that question, and Mitali for setting the context for the study. And we did try to estimate the number of Indian women facing spousal violence in 2020. There was a lot of data quality and availability issues for domestic violence, and especially during COVID-19, we did not have the real numbers available, and multiple assumptions were made in this entire projection. So I'll just quickly take you through the methodology and then focus on what the actual numbers were. So we started with the entire female population of for India in 2019, and the proportion of married women as per the census 2011, and the proportion of ever married women who have ever faced spousal violence in 2019 as per the Health and Family Survey. This is not to be confused with the crime records, but the number of women who have just said on a survey that they faced spousal violence. Using these three numbers, we came to the Indian women who have faced spousal violence in 2019, the actual number and not the proportion. And we also had the number of filed complaints of spousal violence in 2019 as per the crime records. Using the 2019 numbers of complaints and prevalence, we came up with the complaints to prevalence ratio for 2019. And we also had the estimated number of complaints received in 2020 from a subset of the crime records, which is the National Commission of Women numbers, the numbers from National Commission of Women. And using the complaints to prevalence ratio for 2019 and the estimated number of complaints received in 2020, we tried to estimate the prevalence, which is the number of Indian women who have faced spousal violence in 2020. And if we move to slide 6, I can show you what those numbers were. So in 2019, we saw that 84 million women said that they have faced spousal violence in any kind, which is either emotional violence or physical violence or sexual violence. And but against the 84 million women facing violence, only 150k women actually reported it in the crime in India report against in the crime records, which gave us a complaints to prevalence ratio of 0.17%. And using this, we tried to come up with two scenarios of complaints to prevalence ratio, and we saw that the 2020 prevalence of Indian women facing spousal violence could be anything between 150 million and 178 million. So if we move to the next slide, we can see it in a chart. Where in 2018 we saw that 85 million women face spousal violence, and in 2019 we saw 84 million women facing spousal violence. But in 2020, because of the COVID-19 pandemic and the lockdowns, we saw that number could be anything between 150 million and 178 million, which is a huge number. And because of this huge jump, the government and other stakeholders, which is the civil society organizations, had to conform and regroup and try to regroup and see how those services are catering to the women who are facing spousal violence at this large scale, which is double of what was seen in 2018 and 2019. So this is how some of the projections went. And yeah, thank you.
Thank you for that, Manvika. It helps us lay the ground for how prevalent domestic violence in fact is and how the spike was observed. And now that we know that it is very evident even from the increase in the complaints of domestic violence, what role did the government, and Geetika, I want to ask this question to you, what role did the government play in combating and curbing domestic violence through its various schemes or initiatives?
I'll begin with what the scenario was before COVID as well. So the government in India has been undertaking several initiatives and schemes. There are currently 9 active schemes to support domestic violence survivors, which mainly cover several thematic areas, including ease of reporting, providing shelter homes, legal aid, psychosocial support, counseling, and sensitization of police. But there are only 3 schemes which are focused on domestic violence, and I'll give you a brief about those as well. And these schemes were largely started way before the COVID-19 pandemic in around 2015, when the government properly launched these schemes. So the first of these is the one-stop centers, which are facilities that provide integrated services, including medical assistance and complaint lodging support and legal aid and shelter to women who have been affected by violence. Similarly, we have something called Swadhar Greh, which are short stay homes, which again offer victims shelter, food, clothing, counseling, training, and other such things. Lastly, we also have the Women Helpline, which is a national helpline and something that provides 24/7 emergency response service to women who have been affected by violence. And this Women Helpline it aims to provide a comprehensive assistance and direct women to the appropriate authorities such as police, hospitals, and other such things. Now, moving on to what were the emergency measures undertaken by the government and by the central and the state governments during COVID-19 because of the increasing number of women who were getting impacted. So we can categorize these emergency response measures under 4 verticals. First of those will be logistics and operations. Second will be reporting and legal services. And third is awareness campaigns. And the last one is health. So for the first one, which was logistics and operations, the Ministry of Women and Child Development, it shared guidelines for continued operations of essential domestic violence services. And it provided guidelines for everyone and shared details on how the district collectors and magistrates could arrange for social distancing and provide protective care within the one-stop centers that are prevalent in India across across all states. Similarly, the National Commission for Women, they held virtual capacity building workshops across states, again communicating safe standards, operating procedures, quarantine requirements, menstrual hygiene, and other provisions that could be provided in their shelters to support women who are in distress. In addition to this, the city level police units and the community health workers and the Anganwadi workers that are there, so they were also given capacity building workshops to be enabled to increase the awareness and provide rehabilitation initiatives for people. As an example, Tamil Nadu, which is one of the states in India, they launched a response system to rescue women who are suffering from domestic violence. And the Anganwadi workers there, they acted as coordinators to ensure that this rescue mechanism was being undertaken properly, and they were receiving and escalating all the domestic violence related calls to superior officials. The second pillar that we talked about, that was to ensure that there was uninterrupted legal services which were provided to the victims. So NCW again launched a WhatsApp helpline, this was a dedicated helpline to support women who can actually complain, come out and complain against their perpetrators. And this is one of the data that we used for our projections as well, as mentioned by Manvika. So this commission actually tracked all these complaints, and they fast-tracked these complaints to provide immediate security to survivors. Similarly, there we have something called Mahila Thanas, which are police stations which are operated by women. They were also promptly activated, and in different states, which were, to name a few, were Madhya Pradesh, Bihar, Orissa, Punjab, Tamil Nadu, amongst others. So these special cells, they established again their local helplines and directed survivors towards whatever shelter homes are available in their state and operating, and also provided counseling services and assistance for medical aid and other such services for the victims in distress. Thirdly, there were also several national awareness media campaigns that were organized by the National Commission for Women, as well as different states. Two of those and the national level ones were called hashtag Say No to Domestic Violence. And the second one was Suppress Corona and Not Your Voice. And these were featured on national news broadcast, Doordarshan, All India Radio, and other private television and radio channels to ensure that to ensure maximum circulation of these awareness campaigns. And similarly, in different states, like in Maharashtra, there was Unmute the Abuse campaign. In West Bengal, there was Stop Domestic Violence campaign. And like these campaigns were also in different states were held in close collaboration with the other NGOs and community-based organizations that are operating in the state and who have who were in touch with the civilians on ground. And lastly, to provide, because even mental health of everyone was at stake and like it was getting impacted. So the National Institute of Mental Health and Allied Sciences, they provided a telephonic psychological counseling aid for women who were facing domestic violence and other forms of violence through a helpline number. And again, this was linked with other facilities that the government is providing, support services that the government is providing, such as one-stop centers and the women helpline. So though these initiatives were undertaken, we can still see that, like as mentioned by Mitali and Manvika, that there were a lot of women who were still not able to come out and complain, and they had to endure whatever the domestic violence that was really happening during the shadow pandemic. Thank you.
Thank you, Geetika. That was a very informative answer. And as you said, and as was reiterated throughout the discussion, the role of the government is important, but it does not end at that. So taking this forward, I would like to ask you, Mitali, how, apart from the government, how can private stakeholders and even at large the civil society change the way the response has been to domestic violence, and how can we build a more effective support system and ensure that recovery from COVID-19 itself is gender sensitive?
This is a very packed question. So, let's try to unpack it a little bit. The first thing is that, as we noticed right up front, and, we talked about this right at the beginning, we have to stop considering that it's only the government's responsibility to address the issues of survivors of violence against women. And not only women. Of course, today we focused our discussion a lot on women because we have at least been able to create data for women. I wouldn't even say that it's available, but we've been able to extrapolate and have some estimates. But for persons of minority genders and for the LGBTQIA community, we have not even got separate estimates or data. So, the first step really is to keep ourselves informed. We have to collect data. And again, that data collection can be done by private agencies. There are so many private agencies in India that are doing data collection. But collection of domestic violence data may not be on their radar. So, this can be definitely one area in which civil society organizations and donors and CSR can come in and say that, look, we want to do more research on domestic violence, and for that we need the data, and therefore private agencies will then be motivated to collect the data which is gender disaggregated in the true sense, not only in the sense of men and women, but amongst a larger number of groups across minority genders. So that's really, one area which needs a lot more push, and not only from the government. The second aspect is to really think about how are we, framing the question of investment in domestic violence prevention and management services. Because at this point, when we think about domestic violence, we think about it as a social necessity that the government should set up some facilities and that's about it. But I think that domestic violence needs to be looked at as a community management issue. given the numbers that we've got of the prevalence, if we are saying that in a year, minimum 80 to 90 million women are being impacted by domestic violence, then government facilities cannot deal with that amount of influx and that pressure. And then the second, aspect is really around the fact that it's not only about the geographic concentration, because these are cases which are coming up more and more and more in larger cities where the reportage is higher and that's where the facilities are higher. But we know that it's spread across the country. And that's why community management and community issues and rehabilitation becomes even more important, and even community level mediation. Because in many cases, people don't want to go to the police. The police being the only agency to whom you can complain automatically becomes a deterrent to women survivors who, don't want to say break the family, right? They just want a relief. And there are many other mechanisms like community level reconciliation, panchayat level interventions, resident welfare associations getting involved, or even within family mediation, which can be undertaken where relatives or close friends or family members get involved, or community based organizations can have a role to play, where it can be done in relative secrecy. That the aspect of privacy and secrecy, and not making it out to be something which is very public and to be dealt with within the family, becomes important as well in the Indian context. So I think we have to think about more and more alternative channels of reporting, which are community led, community managed, and spread out amongst the country in a decentralized manner, but at least have some training, guidelines, and support from the government as well as from community based organizations. So we need a system, we need a systemic overhaul, and we need systems to be built at different levels. So that's the second aspect. The third aspect is, how do you deal with this in workplaces? Because often your workplace is the one place that you may trust outside of other channels. And at least for the women who do work, this can be one area where you can trust your colleagues, you can trust your you can trust your HR, for example, because you are employed there and you have been working there for some time. Maybe it can be one area where women can go for redressal. And I think workplaces setting up systems to support women who are in distress within their homes can also be an effective mechanism. Workplaces already are mandated to set up POSH committees for dealing with sexual harassment at the workplace. And therefore, since many of these committees are already functional, it may be just about going one step forward and saying, okay, let's also try to have some systems in place, maybe in partnership with community-based organizations, to also, support women employees who wish to complain about the domestic violence situation in their homes. And then beyond this, I think we have to think about media and community level campaigns, and really large campaigns led by, personalities, stars, social media influencers, and especially men and boys. It's important for men to take a stand and to say that violence is just unacceptable. I just want to give a pop culture reference here of the ongoing trial between Johnny Depp and Amber Heard. And I think a lot of people globally are following that trial, and it's becoming such a convoluted case that it's taking away from the prevalence of domestic violence amongst women. Because that case is a case of maybe a woman defending herself, and or it's a case of a woman being an abuser that will come out as the legal proceedings move on. But at some level, the way the media reportage of that case is being handled, it's coming across as though it's diluting the issue of violence against women and of domestic violence in particular. So it's very disturbing. And this is exactly what needs to be refrained from, and this is exactly the kind of sensitization that we require in the media, that, when a domestic violence case needs to be reported upon, it should be dealt with very sensitively. And of course, violence against men also needs to be dealt with equally sensitively, when it's if it's on both sides, as in this case. But in the Indian context, it's extremely important that all of these different entities, central governments, state governments, community-based organizations, media, and on top of that, the private sector, employers, can all come together and start to look at domestic violence prevention services as an essential service, the way we look at healthcare services, the way we look at education services. This is part of social infrastructure. This is our country's social infrastructure. It's not a cost center. This is something which the government and other agencies, as well as private sector and employers, need to invest in the women of this country to enhance and protect not just their labor productivity, but also their human rights. And there's a business case to be made, there's a rights-based case to be made, but the case is clear that domestic violence services are a basic social infrastructure service, like healthcare and education, which are owed to more than 50% of the citizens of the country, and need to be looked at as such, not as expenditure or costs, but as investments, as an infrastructure. So I think that's the way we move forward on this.
Thank you for your answer, Mitali. And just to re-emphasize on a few things that you said, I would like to bring back two of the articles that were authored by you that were published some time back, and just pick up two of the quotes that really sum up what you said. One of them was how as we move towards building back better post-COVID-19, the social infrastructure and services required for prevention of violence against women need to be viewed as investment in the country's human capital rather than expenditure line items in budgets, and which you talked about in your answer as well. And something that the Global Shapers New Delhi Hub had been doing is taking sessions with young people to encourage them to speak up and share their stories and condemn domestic violence, which again brings out is the first step towards complaining and speaking up about it. So
exactly.
Yes,
I just want to take this opportunity to really talk a little bit about the initiatives at the Global Shapers New Delhi Hub that we've been doing on ground. And of course, I started that project while I was curator of the hub in 2020. In fact, I was called the COVID curator because I literally took on the curatorship of the hub when COVID began, and in my entire period was marred by lockdowns. But through that period and even now, we are doing a project on prevention of domestic violence, and about working with young people across Delhi University in different colleges, where our team goes and does bystander intervention and training sessions from the Global Shapers New Delhi Hub to maybe the women's development cells across different colleges of DU. And we just take these sessions, and in many of these sessions, I think Manvika, Gitika, and other members of the team have led many of these sessions, and we have just heard so many stories which are, I mean, of course, people's real experiences of how they have overcome domestic violence in their homes, in their families. And in fact, it's been a huge learning experience for all of us, to try to develop a greater empathy for the people who are going through this, because it's not only the person, of course, the person who has undergone the violence, it breaks their complete confidence, and the mental impact lasts far beyond the physical impact, but it breaks the entire family as well. And that's what we are seeing amongst the kids that we are talking to, that how it has impacted them and how can they deal with it. And these are the kind of tools that we try to empower and equip them with. So now we just have a few snippets with us of how we are doing this. So we can just play those as we end today's session. So a big thank you to Gitika, Manvika, Ashmita, all of you, for being here and for supporting this work and for coming together as a team so that we could do this research, and also for the groundwork that we've been doing. So we'll now leave you with just a few snippets of the work that we've been doing and testimonials, etc., from the students. Thank you.
I will say here that individuals who witness or are aware of violence being perpetrated can play an important role in helping survivors. The most important thing is that such intervention always has to be cognizant of victims' needs and circumstances. The most important one to me personally is the idea of financial independence. I know how much my mother struggled, because her first instinct when she left was, will I be able to provide my children the same life that they've had while I was married and we were a 2-income household? Will I be able to provide those same things for my children? And it was hard. I know she kept us in school by selling some of her Stridhana gold jewelry. And it's amazing to me that we don't talk about these issues because we assume that there is an ostensible privilege that is coming with it. Of course, if she's walked out, she would know what she's doing. We don't know somebody's circumstances when we meet them. So how do you encourage them to keep control over those finances? I know my mother had money that she used to stock away separately, and she had control over her own bank account. How do we encourage our peers and older women to take control of your money? I think that's the first conversation, in addition to, of course, the other things that we need to be having about this, is how do you become so financially independent that you're not dependent on someone else for that? A lot of this is about getting women back into the workforce. And we're talking more and more about how many jobs are being lost during COVID.
So domestic violence is so prevalent and so out there that, people start taking it for granted and start considering it to be normal. And even victims think that it is normal. How do we address this, and what are the sort of conversations around it that can go?
So the normalization aspect of this has always been that it's become so common as an occurrence, and I completely agree with whoever put that question there, is that we have internalized it to a degree that it is no longer seen as being problematic. And you're absolutely right when you say this is a completely separate issue. It's not actually limited just to our homes. So the question, and again, the question before us then becomes, how do we start to have these conversations? You start by making sure that you recognize it when it happens. You should not have to put up with abuse from anybody. And drawing that line for yourself and drawing that line for everyone around you is the most important thing. To remember that you can draw that line. It is yours to draw, and nobody else's. I think that is the most important thing that you can give to someone, that you can give to yourself, knowing that there is never any call for violence. There's never any call for aggression, not at home, not at work, not in your public life. Just it's completely unacceptable. We start by normalizing the unacceptability of violence.
You have been listening to the INCJ podcast. conversations about international criminal justice. To find out more, go to our website at criminaljusticenetwork.net or follow us on Twitter at INTCJ Network.